As we mentioned before, I belong to a group, and it's not a small group at all. It's what? Significantly over half of us that are at significant risk for this issue due to the fact that we don't methylate very well. You want to talk for a minute about homocysteinemia and methylators?
What you're saying in the big picture, it's all about the blood vessels because the blood vessels deliver the nutrients and the nourishment and they haul away the garbage. So anything that damages the blood vessels is going to show up first in the eyes, next in the brain, then in the peripheral nervous system, and later on, years later, in the heart and the kidneys and things like that. And homocysteine is one of the controllable risk factors that we can deal with. You don't smoke, you keep your blood pressure down, you keep your blood sugar down, and you control homocysteine. And you can control homocysteine with, as the chart up here talks about, with L-methylfolate, vitamin B6, vitamin B2 riboflavin, and methyl B12. So with those and another substance called trimethylglycine, you can lower homocysteine down to an ideal level in over 90% of the patients. And homocysteine has been shown to damage the blood vessels, to damage the capillaries. If you inject homocysteine inside the eye, you can just watch the retina melt and die. It's the lower the homocysteine, the better. It's not like cholesterol that you can go too low. You can't go too low on homocysteine, but it's pretty hard to get below 6. But the all-cause mortality rates on homocysteine, the kind of a break point is at 9. So if you can get below 9, you're really going to shift the needle. And homocysteine damages the blood vessels, the endothelium. And if you think of a capillary, which is the nourishment goes in and out, it's basically just an endothelial bag. And so you damage that, you've damaged the whole system. And because the eye has the highest oxygen and nutrient demand of the body, the eye has the highest blood flow of the body per gram of tissue. And the macula is the highest of all because that's where the highest density of photoreceptors are. And you start seeing things like drusen and diabetic retinopathy. It often shows up right there in the center around the macula. And so one of the things you can do to reduce risk of diabetes and diabetic retinopathy is lower the homocysteine.
And how do you do that?
The simplest way is to take some sort of supplementary high doses of vitamin B2 riboflavin, vitamin B6 pyridoxal 5-phosphate, L-methylfolate, and methylcobalamin. And you don't want the junk, cheap stuff. You want the natural forms of the vitamins that's a meal already cooked.
So what would be the junk and what would be the natural stuff?
There's only one kind of riboflavin, so that's okay. Pyridoxine is the degraded form of B6 that's in most vitamins. But P5P or pyridoxal 5-phosphate is the active form, and it's the always non-toxic form. Folic acid is the synthetic that they put in all of our foods, but it's very hard for the body, especially with those of us that have MTHFR defects like you and me, very hard for them to convert it to L-methylfolate. So give the natural form of L-methylfolate, and it's a meal already cooked and ready to go to work. And the same thing for cobalamin. Methylcobalamin is a meal already cooked, ready to go to work, ready to donate that methyl group, which knocks out the homocysteine. The other reason you don't want to take the junk B12 is cyanocobalamin, which is what's in most vitamins, most of the thing you find on the drugstore. Cyanocobalamin is a synthetic form of B12 that is 2% cyanide by weight. And it's okay for a young, healthy person, but if you've got a diabetic that's got some early kidney damage, you don't want that 2% cyanide metabolizing in the kidneys. And occasionally that can be fatal for patients with advanced diabetic renal disease. So because the methylcobalamin is always non-toxic, and because the methylcobalamin has the methyl group to immediately neutralize the homocysteine, it's much more effective than cyanocobalamin.
So that's very helpful. For those of us who have studied this is not the first time that we've heard, don't use the cyano. Cyano is a cyanide moiety. And for most people, it doesn't cause a problem. But for some people, there may be an issue. I'm going to ask you to walk us through these slides of the eyeball. But before I do, I'd like to give my own brief explanation of this antioxidant issue, the methylation issue, and where it fits more globally. You know, if you go back to high school and college biochemistry, we have a thing called antioxidants. You know, if you look at the Krebs cycle, you look at the basics of how we metabolize. We as humans have significant advantages over yeast, for example. A yeast will get 6 energy units out of a molecule of glucose. We, on the other hand, get 36. The reason we do is we have an oxidation component. That oxidation component is linked, as many of us learned in high school chemistry, to combining oxygen with a substrate or a fuel. Well, glucose is the fuel here and some other things, and oxygen is being transported in from hemoglobin. That's why this whole process of breathing and hemoglobin exists. Well, those of us who've studied aging know that the mitochondrial theory of aging is one of the most dominant theories about mechanisms of aging. You know, it's like if the mitochondria are the furnaces of the cell, then, you know, just like any other furnace that's been burning stuff for 60 years, sometimes those burning embers burn a hole through the side of the furnace and you've got these burning embers lying around. That's basically the very informal presentation of the mitochondrial theory of aging. So that then creates a whole new industry, the antioxidants industry. You know, people think of vitamins A, C, and E as the antioxidants. And they are, but really, when you look at how the human body does this, the human body does antioxidants or reduction in a slightly different way. To go back to high school and college chemistry, oxidation is the addition of an oxygen molecule, and reduction or reversal of that is simply another addition of hydrogen molecules. The human body does not do that. We don't add a hydrogen molecule, we add a methyl, what we call a moiety, or a portion of a molecule. A methyl molecule, that's 1 carbon, 3 hydrogens. Now, it accomplishes the same thing. It neutralizes all of those oxidants that are lying around. So why would we want to take vitamins A, C, and E when our own body really doesn't do that? Our body uses methylation, methyl groups, because, as Craig and I are talking about, many of us have genetic problems with that process. The mutations, and they're well known, C677T and A1298C are 2 of the most common. I've got 1 copy of one on one gene and another copy of the other on the other gene. And so my body doesn't methylate very well. Now, it's fairly simple to deal with that. And it's exactly what Craig has been talking about. You replace it. There are some over-the-counter versions. Those of you who go into Amazon will lose monetization on this film because I'm going to mention a few labels. Thorn Methylguard or Methylguard Plus. You can get that on Amazon. It is basically a group of B vitamins that have already been methylated. Now, as Craig talked about a few minutes ago, there's some significant advantages and disadvantages regarding which preparation of methylated B complex vitamins you take, but the whole purpose of the past minute and a half was to help us put all of this methylation in perspective. Craig, I went down a long bunny hole. Any comments or desire to bring us back to the topic?
Well, because these systems are interconnected, these B vitamins indirectly act as antioxidants because they impact glutathione, which is a cysteine-based compound. The other thing is that the antioxidants not only directly quench, but they recycle glutathione, which is the master antioxidant in the mitochondria. So I always think of these things as, what can I do to help glutathione? Okay, I'm going to put some C and some E and some lutein and zeaxanthin and alpha lipoic acid and some other things to help that. And then I'm going to give N-acetylcysteine, which is a substrate that's the backbone molecule that can then be easily converted into glutathione. So to me, it's all about decreasing homocysteine and raising glutathione.
Exactly. He's a prevention guy that's much more well known than either of us, and he calls glutathione the mother of antioxidants.
Mark Hyman.
Yep, that's right, Mark Hyman.
Continue to get great feedback regarding the webinars, and here's why. You know, on the internet, when you hear a webinar, you expect for somebody to try to sell you something. We're not doing that. We're trying to tell you something. People are coming in with their labs from Quest, inflammation panel, OGTT, insulin survey response, And then they're finding out, do I have inflammation? Do I have insulin resistance? And where does that fit in terms of other folks? We're getting ready to start one for CINT as well. So again, people are really excited about finding out their own status. Looking forward to seeing you there. Thanks.